Good morning. I'm really excited to bring to you our next special guest here on the Youth Veterinarian Initiative, which we fondly call YVI, with my co-host, Dr. Monique Wells out of Paris, France. And now, before we proceed, I want to get back over to I've been looking at the ferrets that we've been talking about, and I've got to go back over to, so I want to introduce our esteemed guest. Dr. Athema Etzioni is a board-certified veterinary clinical pathologist. She was homeschooled and entered college at Xavier University of Louisiana at New Orleans in the spring of 1994 and received her BS degree in biology pre-medicine with a chemistry minor in spring 1997. That fall, she was accepted into Tuskegee University College of Veterinarian Medicine, Nursing and Allied Health, now College of Veterinary Medicine, which is TUCVM. At the tender age of 24, she received her doctorate of veterinary medicine in May 2001 and went on to complete a veterinarian clinical pathology internship in the Department of Pathobiology in May 2002. Dr. Etzioni she completed a residency and master's degree in veterinary clinical pathology at Purdue University School of Veterinary Medicine in the fall of 2005. Since then, she has worked in the shelter, research, academia, government, corporate, and private practice sectors of veterinary medicine. In October 2015, she rejoined the faculty of TUCVM, and that's Tuskegee, Alabama, and currently serves as associate professor and section chief of veterinary clinical pathology there. She's also the director of clinical pathology at the Center for Integrative Veterinary Medicine, and that's in Alexandria, Virginia. She's an associate veterinarian at South College Veterinary Clinic in Auburn, Alabama, and a relief small animal veterinarian who is USDA accredited and licensed to practice veterinary medicine and surgery in Georgia and Alabama. Now, personally, Dr. Etzioni's husband, I'll get it, is married to Dr. Baruch.
He's not doctor, it's just Baruch Etzioni.
Yeah, a wonderful husband, Baruch. The couple has 4 beautiful children. Okay. I didn't even ask the name of your daughters. Please name them.
I will say them for you. It's fine. So, son, Akibalon Etzioni, and 3 daughters, Naila, Zaria, and Iman. And then we have 6 fur babies. And that includes 2 German Shepherds, Peachy and Perry. And we also have a Great Dane. Sorry, the Great Dane is Perry, and then Peachy and Gus are the 2 German Shepherds. And then we have 3 ferrets, Brown Sugar, Ivory, and Pepper. Pepper's the girl, and the other 2 are boys. And then with the dogs, Peachy's the girl, and the other 2 are boys. So,
okay.
Incredible. That's a huge household.
Thank you, Athema, for being with us today. And I'm so excited about what you have to share with our community.
I'm excited as well. And thank you both for having me. It is an honor to be in this group and to, be asked to give this presentation. Initially, I was to speak with the students on veterinary medicine and then give answers to some questions that were posed by the 6th graders. But the questions were so good and plentiful that I made the presentation from the questions that were asked. So here we go. I want to know how to make animal medications or medicine for my dog and cat. All right, so this is beyond the scope of this presentation. You go to vet school or pharmacy school to learn about these things. And so I am not going to tell you how to make medicines for your patients, for your pets. If your pet is ailing, you want to bring them to the vet so that the vet can diagnose the problem and give the right medication, okay? But if you give your pets a balanced diet and make sure that, you give them the preventative medicine so they don't get the fleas and the ticks and the heartworms and stuff. And just do all you can to keep them healthy and safe. Walk them on a leash, make sure that they don't get run over by a car. Then you'll keep them out of the hospital having the need for medication. So these are some of the things that we need to keep in mind. Okay. How hard is it to be a veterinarian, and how long do I have to attend school in order to be a veterinarian? Okay. So that is kind of relative to how long it takes you to do each step. So completing elementary school, completing middle school, completing high school, or earning a GED. I actually was home taught, so I didn't go to high school. So I actually earned my GED when I was 16, and I went to college when I was 17. So getting a GED is like getting a high school diploma, only you go straight to the test. Prerequisites that we talked about, you have to take certain classes before you get to apply to vet school, because they have to know, did you pass your anatomy? Did you pass your physiology? Did you pass your microbiology? Did you pass your history, your sociology? Did you take a language? Did you take physical education? These are some things that they require you to have experience before you get to the point of applying to vet school. Some people get an undergrad degree while earning their prerequisites, but some people don't. So you don't have to have an undergraduate degree to come to vet school, but you do have to complete those courses, and they can vary depending on what vet school that you want to apply to. So at Tuskegee University, we have what's called a 3-in-1 program. So we have a program where students can come into vet school early and then complete that last year of undergrad courses as a part of their veterinary curriculum, and then get their DVM and their bachelor's degree together. Okay, make sure it's what you want to do. Speak to somebody in the area of veterinary medicine, such as now you're listening to me as a veterinarian talking to you. You can also visit local, places that, have animals, like your shelters, your veterinary clinics, zoos, and talk to the people who care for these animals so that you can get an idea of what they do. Shadowing is something that, is good, but it's also better if you get the hands-on experience. So when I was growing up, I lived, I would say 5 miles maybe from the SPCA, probably less than that, maybe 2 miles. Across the bridge and down the street, I went almost on a daily basis to go to the SPCA. I was too young to work there, but I was so persistent. At 16, they gave me my own set of keys. They gave me my own set of keys so that I could, take animals out of the kennels and show people, let them touch them, let them hold them, let them spend time with them so that they could adopt them. So I had my own set of keys, but I wasn't working at the SPCA. But I had lots and lots of experience because I was there every day, and they were like, hey, all right, here you go. So then eventually, once I became 18 and I was in college, I actually got a job there working in, education and stuff. And I enjoyed all of my experiences there. So stay focused, make sure that you get that experience, and start small, get a pet. And, you don't have to start with getting a lion, which I don't recommend at all. You can start by getting something really small. Like I had cats. And, cats, they use litter boxes very well. They went inside and outside, but nowadays I'm like, keep them inside because we can't stop them from getting things like feline immunodeficiency virus, which is FIV. And FIV is like human immunodeficiency virus, but in cats. So HIV, we know, is something really, really, difficult for some people to deal with. And that can, predispose them to AIDS, which is another immune disease. So since we can't stop them from getting FIV, and we can't stop them from getting leukemia, if feline leukemia, which is a type of virus that can give them actually leukemia, like we talked about, then keep them indoors so that they don't get exposed to it, because it's a sociable thing that they can get from other cats. So we can vaccinate against the feline leukemia virus, but not against the FIV. but just keep them indoors, keep them safe so they don't get into those fights. Another thing that I wanted to talk about is because if you let your cats outside and they're declawed, they can't defend themselves because, you know, they scratch and stuff. That's what they do. If they don't have claws, they can't defend themselves properly. So that was a side note. All right, so stay focused, study hard, and get experience. Or even start with a vet.
Before you go further, I heard you say something that I hadn't heard a vet say yet about language. Is that a required thing usually, learning another language, or it's just another thing that you suggest?
So just taking a language class, it's not a requirement at all for you to learn the language. You know, you don't have to prove you know Spanish or prove you know French or Latin or whatever. I took Latin and I took Spanish both in undergrad. I was self-taught with Spanish a little bit before I went to undergrad, and then I took a year of Spanish and I took a year of Latin. And I took the year of Latin thinking that it would help me with the medical terminology because Latin is the base of medical terminology, but it was conversational Latin. So ita vera, you know, I learned how to speak it, not, you know, it wasn't telling me about the basis of the Latin medical terminology. So, but medical terminology is a required class. Medical terminology is required so that you can learn the lingo, learn what you're learning about. So if you know ahead of time what microfilaria are, if you learn ahead of time what it means to say inflammation, you know, itis, if something has the itis on the end, that means inflammation. So medical terminology is required before you apply to vet school so that they can make sure you have this basic information, because sometimes when we're teaching, we're talking with these terminologies. And so just like with anything you haven't experienced before, it's like a foreign language. So if you don't study it, then you won't know. So like if you have a foreign language and you go over to Germany, you haven't never spoken the language before, you can't know how to ask for the restroom or where's the restaurant or how to get to the cab, you know. So you would at least learn like the basic language, or you would have a guide that could speak for you to let you know what's going on. So going to vet school, realize, is like learning a language. You have to do your studying before you get there. You have to learn a little bit before you get there. All right, so these are some of the areas of veterinary medicine that you can go into. Sports medicine. So, you know, we have racing greyhounds, we have racing horses. These animals need veterinarians that know how to deal with lamenesses specifically. So these are specialized people. You can be a specialist in any area. I'm a specialist in clinical pathology. So we talked about the blood, diagnosing tumors and stuff like that. Aerospace medicine. There are animals that go into space. You know, we do have these things now. They had a chimp or something in space, and this was decades ago that they showed the chimp in space. Animal assisted activity and therapy. So we have animals that are nice enough that they love everybody that they see. So these animals are, therapy pets. They can actually go to nursing homes and schools and things of that sort and be loved on by all that want to love on them. And they won't do anything harmful. Mm-hmm. These animals have to go through rigorous testing to make sure that they won't do something that's not, not good. So, if you bring an animal to a nursing home or to a school, you don't want that animal to bite anybody. You don't want that animal to scratch anybody or, bark really loud or growl or do things that, may make people, shy away. You want to make sure that they're able to understand that there's different noises in the environment and, just different things that they have to be aware of and not react to adversely. So, we talked a little bit about government and academia. I'm in academia and I've been in industry. And like I said, I'm in research and private practice. So you can work in various areas. And then I actually don't have on here, food inspection. So FDA, food inspection, making sure that you don't get green meat at your school, at your house. All right. So professional activity, of course, a lot of people go into private practice, but then there are some other breakdowns. And I know this presentation might have to be broken up into two parts because we're taking a little bit longer than we initially planned. But, you know,
work. That'll be fine.
Okay. So, you know, again, a lot of people go into private practice, but there's a breakdown of some of these other type areas as well.
And you talked about foods inspection, but that's federal. FDA is
Yeah. Okay, cool. So maybe I did represent it a little bit, just a little bit.
we did have someone that really went into a lot of detail about food inspection. That was very interesting. Yeah.
Wonderful. I don't have any meat in here to show you. I'm sure they showed you some stuff. All right. So are animal medicines safe and effective? So we say animal medicines. There are some medicines that people take that animals can take too. But again, I'm not going to be the one to tell you what animal medicines and human medicines are the same, because you need to bring your pet to a veterinarian that practices to diagnose a problem and give you a medication for that problem. So I'm not going to tell you that, you know, you can give your pet this, that, or the other. Okay. So you have to base the medicine on the size of the animal, the type of animal, the breed of the animal, sometimes even whether it's male or female, that you want to make sure you give the right medication. Depends on the problem you're treating as well. Are you treating something that's on the skin topically, or are you treating something that's internally, like in one of the body organs? These are things that you have to consider when giving medication. So, you know, if you have like a little bobo on the skin, then you can put medication directly on that bobo. But also keep in mind that a lot of animals, especially dogs and cats, they have hair. And like with our German Shepherds, their hair is really thick. So if I'm trying to treat a skin problem, I might have to give systemic medication, so something by mouth. But other times, like if it's just one little small spot, then I can shave the hair off of that spot and treat that spot directly. So we have to think about those kind of things. But yes, there are a lot of medications that are safe for animals that, you know, we give on a regular basis. Okay. And then we talked about the preventative medicines that stop them from getting things like heartworms, fleas, and ticks and so forth. So those heartworms that we talked about earlier, they are transmitted, which means dogs get them, and some cats can get heartworms too, and bears. So lions, tigers, and bears, oh my, they can get heartworms. They get them from mosquitoes. Everybody hear me? Do you hear me?
Yes.
Mosquitoes. So when I talk to clients and they're like, oh, he's inside only. My dog is inside only. Mosquitoes get in the house. Mosquitoes get in the house.
Yeah.
Same thing with flea and tick medicine. They can jump on us and get in the house. And if you have a problem with them, they can be a nuisance. Oh my God.
Yeah.
Oh my God. It can be a really, really big problem. Sorry. Uh-oh. It can be a really, really big problem. So you have to make sure that you have your pets on prevention, because mosquitoes can get in the house. And all it takes is that one mosquito that has that heartworm infective stage to bite and deposit that mosquito, to deposit that microfilaria, immature forms, into the blood of your dog. And then it takes 6 or 7 months, and then you get those really long worms that can actually be so many. They live in the pulmonary, which is lung vessel, but they can have so many that they can actually block chambers of the heart. Okay. I wish I put a picture there, but I don't have it. Mm-hmm. So yeah, they can block the heart and cause really, really bad, problems. So we want to make sure to keep them on prevention so that we can keep them healthy. Okay. All right. So what is your favorite animal and why? So I love the kitties. So this is a kitten. This is Rocky. So Rocky was a stray that was brought in and became the love of the entire staff. And Rocky was a kitten. And he had a big belly, But sometimes when kittens are strays and they, don't have the nutrients that they should have, their abdominal muscles as well as their other muscles don't develop as well. So they can have a little bit of a pot belly, but shouldn't be so big that it's bigger than his head. His belly was bigger than his head. I'm sorry, I don't have the picture to show you. His belly was bigger than his head. But this is when he was feeling better. But Rocky was in the clinic before I went to take boards 1 year. When I came back from boards, Rocky wasn't eating. I like to say I attributed it to me being gone and him missing me so much. But I was like, let me look at his poop. Yes, we look at the poop and see what's in the poop. So we call that exam a fecal. So a fecal is when we look at the poop and see if there are parasite eggs or parasite larvae or parasite or other forms of parasites in the feces that tell us that those parasites are in the animal and we need to treat the animal for those parasites. So I looked at Rocky's poop on what's called a direct smear under the microscope. So you guys see my microscope right here? See my here. So this is my microscope, and me and my microscope, we look at all kinds of slides. And, I took Rocky's poop and I looked at Rocky's poop, and he had what was called coccidia. And the coccidia had, they were present in large numbers, and coccidia can make their intestines bleed and they can be really, really sick from having them. So I treated Rocky for the coccidia and he got better. He got better and he got adopted. He was so lovable and they really enjoyed him. So this little adorable kitten got a home, and I'm glad I was able to find out what was wrong with him and treat him. Okay. I love them because they have very sleek personalities. They are pretty self-sufficient. Like I said, you show them to the litter box and they know how to use the litter box. You give them food and water and they're straight. I know some people who have cats, they can leave for weeks at a time as long as they leave enough food out and water. And, they have these self-feeders and these self-watering, containers and stuff like that. And since they have the litter pan, there are some that have revolving cleaners as well so that they can not have the poop building up, because coccidia, that's something that needs to have 24 to 48 hours to become infective. So just be careful of that. But they're overall lovely balls of fur that I just love so much. I'm allergic to them now, so that's why we don't have indoor cats, but we had a couple of outdoor cats that somebody else took in. And we knew somebody else took them in because one of them actually came back with a collar like months later. So I guess they got out and they came back to say hi to us, and we were like, oh my gosh, Twilight. And then she disappeared again. So I guess she went back indoors. So I know she's doing well. All right. So how many times have you created animal medicines? I can't count. It's too numerous. But sometimes we mix medicines with things that we can take as well. When I was younger, we used to use K-roll syrup on pancakes, and you can use cherry syrup in some drinks, but we can also make medicines with that as well, because we have things that the animals need to take, but sometimes the medicine itself doesn't taste too good. So it's not going to help you if the animal doesn't take the medicine. And so we have to have what's called not only patient compliance, but client compliance. So patient compliance means that patient has to be amenable to get that medication. And client compliance meaning that client has to be able to give the medication. So if it's a medication that the animal doesn't like, then you're going to have trouble getting that medication in the animal. So you want to get it to the client in a form that they can give it to the animal and safely administer it without getting bit, chewed, scratched, or otherwise harmed. All right. How does it work to work with different types of animals? All right. It's awesome being able to work with different types of animals. Like I said, I work with all kinds of zoo animals. And these are some of the animals that I've worked with in private practice. I'm going to try to move this a little bit. All right. So we have, a pack of kittens. Oh my gosh, I got the same shirt on today that I have in this.
I noticed that.
That's really interesting. And then we have this pack of puppies, this is actually a Tupperware. This is like a Rubbermaid container. Sometimes people bring pets in interesting containers. Sometimes they just bring them in arms. Nowadays people sometimes just walk in with cats in their arms. And I'm like, back then we never would just walk with a cat in our arms. We would always have them in a carrier because they can get out anywhere. And we have this little bunny rabbit here. This is a bunny that was boarding with us, and she was a sweetie pie. So you see, she's just being held by one of the ladies that worked at the clinic. This is Cinnamon. She's a guinea pig, and she was sweet as well. She came to us just for a physical exam. This down in the bottom is what's called an agouti. And I'm sorry I didn't include the picture that you could see the whole body, but it looked like a rat, but it was called an agouti, Agouti. And this little lovely creature is our hamster, our beloved hamster Nugget, and he's eating a piece of broccoli. So they love fresh vegetables and fruit. All right. These are my ferrets. These are my personal ferrets. This is all three of them down in the bottom left. Pepper is in the middle. Brownie is over here to the left. And Ivory is the one over top of all. Ferrets are sociable creatures, and they love to just kind of pile up on top of each other. And they are really busy creatures. And a group of ferrets is, perfectly called a business. So we have a business. A group of ferrets is called a business. Pepper in the left up here has, she's just yawning. If you scruff them, which is what my daughter's doing here, they'll yawn. It's very funny every time. You scruff them and then they just, this is Brownie, 2 pictures in the middle of showing him just kind of vegging out. He eats and then, he's just tired. So they are very flexible, as you can see here. His nose is almost to his butt. His butt is right here. So, they're very flexible. They almost feel like they don't have any bones because they sleep in so many different kind of funny ways. But, it's so cool. And this is Ivory over here. As you can see, if you pet them the right way, they just fall asleep. So just like cats, they can sleep 20, 21 hours out of the 24-hour day. But I don't think these ferrets sleep that long. They are most active at dusk and dawn. And so you can hear them doing things when nobody's holding them. And, we love them bunches. All right. We also see not so furry creatures. This is a monitor lizard. She came in because she, I don't know if you see this structure here. This is part of her egg sac. So she was holding eggs in there, but she could actually go ahead and pass the eggs herself. So medications were just given to her to kind of support her through the process. And this is an X-ray of her, just showing her internal body organs. I'm not a monitor lizard expert, so I'm not going to point out what you're looking at because I don't know what I'm looking at. So another veterinarian in the
before you go further, I just thought about it. Since our youth that are in the Bronx are going to be seeing this, and we talked about ferrets being illegal in only 2 states, which are California and Hawaii in the United States, but where they are in the Bronx, even though it's legal in New York, it's the Bronx and Brooklyn, and I think it was one of the island. What is it? Well,
it was all the
illegal.
5 boroughs.
Was it Queens?
Yeah, the 5 boroughs. And so I just wanted to touch on that because that may be something that Danielle Corbin and her students may want to look up and know more about, because seeing this, they may want them, but right now they're illegal where they live. So I just wanted to touch on that a little bit. And that would be something neat for them to look up.
Also, something to know about ferrets. So ferrets, they have scent glands, so they can be stinky, but these have those scent glands removed. They are what's called induced ovulators. So just like cats, they can keep cycling into being reproductively active and ready to make babies. So they can have these chronic productions of hormones, which can actually make them sick. But they have been
Mm.
spayed, the female's been spayed, and the males have been neutered. So they have the stink glands removed and they've been neutered and spayed. So we're not worrying about those things with these babies. But those are things that also need to be kept in mind. So you have to be aware of the health and preventative care of whatever type of pets that you decide to take. They also have, you see these teeth in the left-hand side, these really long teeth, and they continually grow. So they have to chew on things. So you have to supply them with things to chew on. They like to chew on the kennel instead of the chew toys that we get them. So same thing with the hamster. The hamster love to chew on the cage instead of the chew toys that we got him. So anywho, something you have to take into consideration. But again, this is a monitor lizard. This was seen by one of the other veterinarians. I do see exotics, but he saw this one. This is lungs up here, and these are probably GI structures and egg structures. And then we see our bones. I can point out the skeleton. So this line down the middle is the spinal column, and it's part of the vertebral column, is part of the skeleton. And within this narrow, you can see this kind of more lucid or kind of a little bit darker area. This is where the spinal cord runs. So we can see this thinner area because at the top of the vertebra, which are the bones in the backbone, there's a thinner covering, and there are larger prominences on the sides of the vertebral column. So since it's kind of thinner and flatter covering on top, we can kind of see that here and know that our spinal cord lies within, but it's a very protective area so that we don't have to worry about our spinal cord getting hit with, you sitting down. You don't have to worry about that kind of trauma. Okay. All right. So how do you get chocolate out of dogs and how long does it take? So we have to give them stuff to make them throw it up, and to stop it from being absorbed. Some other things can also, I guess, come out of the system that way as well. And then we give what's called activated charcoal so that it can bind to the rest of the stuff that didn't come out to stop it from being absorbed as it's transiting the system. So
we need to say that chocolate is poisonous for dogs.
Yes, so chocolate is poisonous for dogs. So thank you to the young person who had this question. So chocolate has what's called theobromine in it, and that's a stimulant, just like caffeine in coffee and certain teas. Stimulants are really bad. So they can, cause excitability in animals, but chocolate can also irritate the intestine and cause diarrhea and vomiting and just overall really bad feelings. There is a general presentation that we all learn affectionately as ADR. So presentation ADR means ain't doing right. So that patient that ain't doing right, that can be a myriad of things. That could be, oh, my foot hurts, or that could be, I got something wrong with my belly or something wrong with my brain. So you got to make sure that ain't doing right is explained. So you got to ask the right history questions. And we ask what's called open-ended questions so that the people can give us more information. So if I just ask you, did your dog eat today? You'll just say yes. That's a closed-ended question. So that's not giving you the opportunity to share with me more information. But if I ask you, tell me about Fifi's diet, tell me about her eating habits, then that opens the floor for you to give me how much she eats, what she eats, when she eats, did she eat, how much she ate, when did she not eat, kind of thing. It gives you the opportunity to just share with me everything you know about that particular history. Okay. All right. So this is the outcome. And just warning, this graphic video for those of you with sensitive stomachs.
Oh my goodness.
So it's brown because there's chocolate in there?
So I know you hear that in the background. You think it might be a dog, but it's actually a parrot laughing.
Ah,
I'm gonna let you hear that a little bit more.
did all of that come from that dog?
All of that came out of this dog. But you hear that in the
This is
background,
really,
right?
this is really,
Yeah.
yes, yes. And this is really
Yeah.
important for young people to know, because with us just getting past Halloween, it's important for them to know to keep that candy from their dogs.
Yes, yes, keep the candy from the dog. So, this was a client that came in, and actually a month prior to this incident, this happened again. So this dog had eaten chocolate that was from somewhere, I guess went in the owner's purse or whatever. And this time the client had gotten a gift from someone, and it was under the Christmas tree. And the dog decided to get out of the kennel, and there you go. So
And
they
ate the paper wrapping and everything.
ate the wrappings and everything. And they came home. They were supposedly only gone for like 30 minutes. They came home to find that the dog had eaten all of these chocolates, and they brought it in 30 days after they had gotten this whole thing done. So they were like, we just, can you do the same thing you did before?
Oh, God.
Basically, that's what happened. But the parrot in the background was a Quaker, and the Quaker parrot was laughing at what was going on. So,
Oh, gosh.
they're very appropriate in what they do.
It's the deal.
Oh, sorry. Uh-oh. All right. So can animals and people take medicine for, can animals and people take the medicine for animals or for people? So yes, like I said, there are some medications that both animals and people can take, but that's beyond the scope of this talk. Got to go to vet school, got to go to pharmacy school to find out what those medicines are. And, or if your actual pet goes to a veterinarian and gets a problem diagnosed that requires a medication, then you can find out, oh yes, we take that. So you can find out at that.
And see, my mom wasn't going to take our animals to the vet, so she would just give them Pepto-Bismol. She'd give them aspirin. She was like, either they take what's in our house or they don't take nothing. So really, we were probably hurting our animals worse.
But you say that, and it's ironic that back then animals, it wasn't unheard of for animals to live like 12 to 15 years. And like I saw a couple animals that were even older than 15 years, and I'm just like, what, a large breed dog? 17? What? 17?
Wow.
So sometimes there are pets that have great genetics and great systems, and they live forever regardless of what they've given. I had somebody say, yeah, I've been giving my dog grapes for some time. Grapes shut the kidneys down. So don't give your dog grapes. Don't give them grapes.
Mm.
And raisins or dried grapes, don't give them raisins.
No.
Grapes and raisins
And I
can
can
shut the
give my
kidneys
dog
down.
grapes. Joy loves grapes. I've got to stop
Oh,
that.
no.
Oh my
Okay.
goodness.
Grapes will shut the kidneys down before you can say hello. They will.
Now, let me ask this, unless we're going to do this in two parts. How much longer for your presentation, they're going to be so interested. I mean, this has been such a great presentation. Oh my gosh. How much longer do we have?
I thought I would be able to see the number of slides here. I don't recall.
Freeze your.
We're ending. We have one more slide. All right. So yes, there's some medications. Yeah, Pepto-Bismol is one, but like I said, you want to have the problem diagnosed by a vet if possible, and then the proper treatment given, making sure the amount is given. With the Pepto-Bismol, they cannot digest those tablets, and they have radiographically dense stuff in those tablets or capsules. So you can see them on an x-ray just traveling through the GI. So they're not going to do anything. So you have to give the liquid if you do give it, but that's interesting because you can see it on the x-ray.
Wow.
All right. So what was the easiest pet you've ever taken care of? It was a middle-aged dog that needed a nail trim. So as we see here, if we don't trim the nails can overgrow, and these are kind of bending back into the paw pad. And I've actually seen some where the nail has grown into the paw pad. And so we call that embedding. And so we have to cut the nail. The pink part is where you bleed. So make sure that we don't cut back there, but we have to cut the nail so that the nails don't, grow into the paw pad, because that can actually make them lame. And so this dog came in, it was, like I said, a middle-aged dog. So could have possibly started having arthritis, but I said, well, let's see what we do with this nail trim. And if this solved the problem, then hey, wonderful. So we trimmed the nails and the dog stopped being lame. Piece of cake. So observation is a big part of being a veterinarian. And once you can pick up the obvious, go ahead and treat those things. But sometimes, like I said, we do have to talk to people in order to treat the people. So this is before, and I'll move this. Okay, and this is after. So we can see how having these, nails so long can cause them to have trouble walking around. Yeah. And so when we trim them, we can see just how nice. And these have been dremeled as well, so we can kind of smooth or sand the edge so they won't be so sharp. Okay. All right. So take home message, give it a try before you decide it's not for you. This is a tiger that was seen at Tuskegee University College of Veterinary Medicine. This is Sam. He's now a doctor of veterinary medicine. This is Dr. Bovelin. She graduated class of 2000 from Tuskegee University, so a year before I did. And this was a patient she saw that had an eye problem. All right, so this is, excuse me. Sorry, this is my information.
Now, thank you so much.
She's coughing. She's gonna get something to
okay.
So while Athema is getting herself some water, I just want to say thank you so much. You can see in the background, you can see that there's a two-headed microscope there. The clinical pathologist uses a microscope first and foremost for like 99% of the work that we do, just like an anatomic pathologist, which is what I am. And we have the two heads because that way two people can look at the same time and discuss what's being seen on the stage. And it's a way to teach, and it's also a way to consult. I miss my two-head. I miss using the two-headed microscope. So Athema, thank you so much. So much.
No worries. I really enjoyed myself. And I, like I said, at some point, I, hope to be more interactive at some point, but thank you for this opportunity. You were amazing. I really enjoyed it.
Yes, you were amazing.
At the end, I don't know what happened.
Yeah, because it was pre-recorded, the fear is that the person presenting also would not be entertaining and hold the attention, but you were absolutely phenomenal. And I can't wait. And that's why, we ran way over, but it's because you were so interesting. And even, see, one of the reasons that I did not, I laughed with Monique and told her how sensitive my stomach is, but the way you presented the information, even before, I wouldn't have looked at showing what came out of that dog. But because of the way you explained it, and even talking about the blood cells and understanding it before, I didn't even want to see my blood going into a vial when they were taking blood. But now the way you explained it, and then I'm understanding why they're taking it and how they're going to look at it. I was brought into it, and I didn't even think about all the things that normally would have made my stomach queasy. So I loved how you present it. I think that not only is it going to be interesting for our sixth graders and for our youth that aren't even in the sixth grade and those that are older, But I think even for adults, this was just an absolutely phenomenal presentation. And I just thank you so, so much and appreciate all the work that you've put into it.
Thank you. And like I said, I truly, really, really appreciate and adore the questions. So thank you for all of those that submitted the questions. I really,
Yes.
really appreciate you. Because without you,
Yes.
I would not have made this presentation for real. So
yes.
thank you all both
Monique?
for the opportunity.
It was absolutely phenomenal. Absolutely phenomenal.
So feel free to send me any questions if you guys have any questions. Go ahead.
If we have any further,
yes.
I wanted to say that for me, so I'm an anatomic pathologist, and for a long time, I really didn't want to have anything to do with clinical pathology. But after a certain point in time, I developed an interest in it. And I'll tell you the reason. It's not because I don't like looking at the slides. You know, we put the blood on the glass slide and we put the fluid and we stain it and everything. That part is fine. It's all the machinery that is required. When you mentioned earlier that we have to look at things, but there's a machine or several machines that also give us a lot of numbers about what's happening in our blood and you know, hormone levels and all of that kind of stuff. I was afraid of the machines, but I love looking at the visuals. I'm a visual person, and that's why for me, I want to emphasize for people who are visually that are visually what's the word I'm looking for? They are
visually inclined.
Visually inclined, yes. That this can be something that is just very, very inspiring for you. And you'll develop a passion for it because you can see so much and you can help the animal, and by extension, often help a person by looking at and interpreting what you see. It is magic. It is magic.
Absolutely.
It is magic. For those of you who like numbers, go into clinical pathology. Because you'll get numbers upon numbers upon numbers, numbers everywhere.
Yeah. You know, the other thing too, with Tuskegee coming up so often, see, only during Black History Month do kids keep hearing about Tuskegee and maybe George Washington Carver. Excuse me. I like the fact that they have now met you and seeing a young woman that has gone through Tuskegee and can relate to that besides just reading about George Washington Carver, and putting that in their mindset that is somewhere that they also can go.
Yeah.
Because so often, again, young people only have heard about something, read about something, and that's so long ago. It's still vital information, but now they've met you and they hear what you. Yes.
Sorry. Go ahead.
Go ahead. No. That's it.
Okay. And not only, you know, knowing that George Washington Carver, you know, he's like the father of Tuskegee, but that there are George Washington Carver schools in a lot of different cities. So we have a George Washington Carver Elementary Academy here in Tuskegee. There's a George Washington Carver school in Montgomery. There's a George Washington Carver school in Opelika. So, you know, a lot of people recognize that he played a pivotal role in agriculture and actually the development and flourishing of Tuskegee University in that aspect.
Outstanding. Monique, any other questions or anything else?
I don't have any other questions. We have Athema's contact information right here. We will most certainly let you know if we get any other questions from our audience. And I guess I think we might have to divide this into 3 parts. This is just so rich. I can't thank you enough, Athema. I can't thank you enough.
You're welcome.
This is why it's so important that we're going to promote it for not having our session, the upcoming session, but to promote this, because we need to make sure that our entire community not only hears this, but shares it with their community, because this was just phenomenal. So I want to thank you again, Athema, because I mean, I learned so much. I learned from every one of our special guests and veterinarians, but this one just was over the top for me. So thank you
so much. Thank you so much. Oh, I do have one more thing. So the presentation I knew was going to go greatly over. But I appreciate the questions and the commentary that, that we had back and forth during the presentation, because it actually did give more information and allow a lot more explanation where I wouldn't have even thought to have that extra explanation. So I do appreciate that, interaction in between, because it helped me explain things that I didn't know people really cared about.
Oh, yeah.
And you know what? And didn't the youth ask some amazing questions?
Yes. Oh my gosh. So amazing.
Yeah.
So amazing.
Yeah. Yes. Yeah. They led the show with those great questions, and then it poured out all that knowledge and experiences that you've had. So some of those questions, I was like, wow, that's from a kid.
and I want to thank Monique, because the question that said complex question, I had seen the second part of it, and I said, okay, I'm gonna come back and answer that other part, but I had forgotten to answer that other part, and she pointed out that I hadn't answered the other part. So thank you, because then I was able to go back and add those additional slides to fully answer that question, because it was just that, a complex question. So
it was.
Yes. I'm just so grateful for the two of you, because there's things that I've always wanted to know about animals. I love them so much, but I didn't have the stomach or the courage to do what you ladies have done in this field. And so I just appreciate both of you so much. And thank you again for this just informative presentation. And I can't wait for us to present it to our community.
Thank you so much for having me again. Really appreciate you both, and had an awesome time. And you guys have a good one. I'll see you next time.